If we can't lengthen from this state and we try to move the hip up into a 90-degree position, what happens is we can't get the hip up because of the restriction here, and we have to tip back excessively. My name's Greg Chapman. I'm a physical therapist and strength conditioning specialist, and in this video we're going to talk all about posterior pelvic tilt, seated posture, and a chair height adjustment that you may need to do, so stay tuned to the video to find out if this applies to you. Without further ado, let's jump right in. So if you're watching this video, you probably have a pretty decent concept of what a posterior pelvic tilt is, but you also might be wondering when and if you should make a seat adjustment to change this position during sitting. So we're going to cover first what a posterior pelvic tilt is, and then we're going to go through some tests that you can use to determine if you should make this adjustment, and then we're going to end by showing you what the adjustment is. So let's first talk about what a posterior pelvic tilt is. So as a review, a posterior pelvic tilt is simply when the top half of the pelvis moves back relative to the bottom half of the pelvis into this backwards or posterior rotation. So this top half of the pelvis is going to move back like this into this posterior tilt. And in terms of the muscles that are going to be involved, we're usually going to see increased activity of the abs, and then we're going to see increased activity of these lower glute and deep hip external rotator muscles. The positions that are going to be associated with that, in addition to this posterior tilt of the pelvis, are going to be a little bit of counter nutation of the sacrum. So that's going to include the tailbone tucking under like this. As we do that, we're going to get a flexed position of the spine, where the spine's actually bending, and then we're going to get external rotation of the ilium bones and the femurs. And that's all normal posterior pelvic tilt positioning. The issue becomes when we do this excessively and this becomes our only option. So let's talk a little bit about how you can figure out if you're using this position too much or if you've used this position to the extent where you've run out of other options. So one of the telltale signs that you probably are overusing this position is if you're having discomfort in your lower back during sitting. So if you're someone who's sitting and you get some achiness in your lower back and you know that you tend to be biased toward this posterior pelvic tilt, then this is probably something you want to address. And if that's the case, here's what's probably going on. So as we talked before, a posterior pelvic tilt was the backwards rotation of the top half of the pelvis moving back a little further than the bottom half. Once we get into this position, we're going to have a little bit enhanced muscle activity in the bottom part of this pelvis, in the deep hip external rotators, and the inferior portions of the glute muscles. Now, as we do this, if we can't lengthen from this state and we try to move the hip up into a 90-degree position, what happens is we can't get the hip up because of the restriction here, and we have to tip back excessively. So in a seated position, it's normal to be slightly posteriorly tilted and a little bit flexed through your back, but we should still be sitting here on the ischial tuberosities of the pelvis, otherwise known as the sit bones. So if we are too far tilted back because we have that decreased ability to lengthen and eccentrically orient these muscles in the bottom half of the pelvis, we're going to have to tip back, and we're actually going to be sitting on our tailbone and sacrum instead of on our sit bones. So the mistake that people make is they think that it's correct to be sitting back in the chair with the hips at 90 degrees, but if you don't have 90 degrees of hip flexion available to you, this is actually just going to push you further into that excessively posterior tilted position, and it's going to cause you to sit on that sacrum instead of on your sit bones. So the fix to this is going to be in a chair height adjustment, which we will cover in just a little bit. But first, let's go through how you'll know that you actually don't have this hip mobility available to you. We're going to run through two tests here, the first of which is the supine hip flexion test. Now to perform this test, you're going to lay on your back, you're going to align your foot, your knee, and your hip. You're going to pull that knee in towards your chest, and you're going to stop the test when there's any deviation of the knee going out to the side, when the hip just gets jammed up and can't move anymore, or when you feel a big rotation backwards into that posterior tilt and that flexing or rounding of that lumbar spine. So you want to do this a couple of times and be really, really precise. And whenever you feel there's that movement of that pelvis rolling back, or that lumbar spine flexing, or the need to deviate the knee out laterally, that is the end of the test. If you don't get to a 90-degree hip angle, then you're probably going to benefit from this chair height adjustment. Now, the other test we can do is a test of internal rotation at the hip. We need internal rotation at the hip in order to access this 90-degree seated position. So what we're going to do in this case is we're going to use our straight leg raise test to do this. You want to lay on your back. You're going to straighten out your leg so that your knee's relatively locked out. You're going to very slowly lift this leg straight up, and you're going to stop the test whenever you get an uncomfortable pull in the back of the leg, whenever there's rolling back of the pelvis or rounding of the low back, or when the other leg pops up off the ground. If you can't get to about 80 degrees, you probably don't have the internal rotation necessary to normally access this 90-degree seated position. You'll also probably benefit from the chair height adjustment. So the chair height adjustment is actually really, really simple, but there's a couple of things you want to watch out for. So in order to change this hip angle to less than 90 degrees so that we don't have to compensate into that posterior tilt, we need to elevate the butt up a little bit. And so we can do this in a couple of ways. So you could do this by simply sliding forward in the chair, which would get your butt on the side of the chair, but your legs coming down at a little bit of an angle. Now, this is maybe not the most ideal because you can't be in a position where your back is supported. So more ideal than that would be to prop your butt up on something. So this could be just using a couple of pillows or a cushion so that your butt is slightly above your knees. Now, when this happens, a lot of people might have difficulty getting their feet to be flat on the floor. And if this is the case, you want to simply put a block or a stack of books under your feet so you can remain grounded when you're in this seated position. Now, I should mention that this is just a fix to reduce any discomfort or any compensation when you're in that sustained seated position. It is best practice to get up and take frequent breaks so that you can stay as mobile as possible throughout the day. In addition to that, if this is a hip mobility restriction that you continue to have, what you want to do is you want to find those activities that help you restore that 90-degree hip position, and honestly beyond some, because if you can only get to 90 degrees, you're right on the cusp of having to compensate every time you're in a seated position, and long term, that's not going to be great. So if you need help with this, go over to chaplinperformance.com, book yourself a movement consultation, and we'll decide if you're a good fit for a movement coaching program where we can work towards restoring this hip mobility necessary so you don't have to compensate and have all those associated discomforts and long-term restrictions in mobility. So I hope you liked this video. If you did, slap a like on it. If you haven't already subscribed, hit the notification bell so you'll know when I upload a new video. If you have any questions, let's continue this conversation down below in the comments. And until the next video, thanks a lot for watching, and we'll see you. Peace.